Have you ever wondered if the secret to feeling better, moving easier, or sleeping more peacefully could be sitting quietly in your kitchen pantry? Imagine this. You reach for a familiar box of baking soda, something you've used for decades for baking cookies, cleaning stubborn stains, or keeping the fridge fresh. But what if I told you this humble white powder could do even more, not just in your home, but inside your body? As we grow older, it's only natural to look for simple, safe ways to ease common discomforts. The idea that a teaspoon of baking soda mixed with water could gently support your digestion, calm your muscles, and even help protect your heart sounds almost too simple to be real. Yet sometimes, the most powerful solutions aren't the newest ones, they're the ones we've had all along. Today, we're going to explore what really happens when you drink baking soda water, and why so many seniors around the world are quietly embracing this age-old remedy, not just as an emergency fix, but as a thoughtful, occasional support for health and vitality. Aging brings incredible wisdom, but it also brings new health challenges. Many seniors experience slower digestion, joint stiffness, unexpected aches, or frequent urinary issues. Interestingly, some healthcare providers quietly recommend baking soda water for seniors to help with certain common concerns. Today, we'll gently walk through 12 ways baking soda water may support your health. We'll explore what modern research says, how to prepare it safely, and important precautions to be aware of. Before we dive deeper, if you're new to our community, welcome. Here, we focus on real, natural ways to support healthy aging with kindness and care. Please give this video a like to support our work. Subscribe so you won't miss future tips, and share in the comments where you're watching from. We absolutely love hearing from you and building a circle of support across the world. And eases heartburn and acid reflux. Heartburn and acid reflux are some of the most common discomforts among seniors. That burning feeling after a meal, the pressure in your chest, the bitter taste in your throat, it can sneak up after even a simple dinner. As we age, the muscle that seals the stomach from the esophagus can weaken, allowing stomach acid to flow upward and irritate sensitive tissues. Baking soda, known scientifically as sodium bicarbonate, is naturally alkaline. This means it can gently neutralize excess stomach acid almost immediately. When you mix baking soda into water and drink it, a small chemical reaction occurs inside your stomach. The baking soda reacts with hydrochloric acid, producing salt, water, and carbon dioxide gas. This process helps raise your stomach's pH, making it less acidic and calming that uncomfortable burning sensation. This isn't just an old wives' tale. Real science backs it up. A 2022 study published in BMJ Open Gastroenterology investigated the use of bicarbonate-rich mineral waters for people with heartburn. Participants who drank bicarbonate water experienced significant relief compared to those who drank plain water. Researchers concluded that bicarbonate offers a safe, fast-acting solution for occasional heartburn and acid reflux. While baking soda water can provide soothing, quick relief now and then, it is not a long-term solution for chronic acid reflux. Overusing baking soda can disturb the body's natural acid-base balance and may even lead to more serious health issues, like electrolyte imbalances. If you experience heartburn occasionally, drinking a small glass of baking soda water after a heavy meal may bring quick comfort. But if you find yourself needing it regularly, it's important to talk with your healthcare provider to address the root cause. Sometimes simple dietary changes or gentle medications are needed to protect your esophagus from long-term damage. Our kidneys are remarkable organs, small but mighty, quietly working day and night to filter waste from the blood, balance fluids, and regulate important minerals. But as we grow older, this tireless system can begin to slow down. Seniors, especially those managing diabetes or high blood pressure, are at higher risk for reduced kidney function, which can lead to a buildup of acid in the blood, a condition called metabolic acidosis. This is where baking soda water may offer surprising support. Baking soda, or sodium bicarbonate, acts as a natural buffer, meaning it can neutralize excess acids in the bloodstream. By raising the body's pH to a slightly more alkaline state, baking soda can take some pressure off the kidneys, allowing them to filter waste more easily and slowing the progression of kidney decline. Baking soda can take some pressure off the kidney. A comprehensive 2021 meta-analysis published In Frontiers in Pharmacology reviewed multiple clinical trials involving patients with early to moderate chronic kidney disease, CKD. The findings were encouraging. Participants who supplemented with sodium bicarbonate showed a slower decline in kidney function compared to those who did not. In some cases, bicarbonate supplementation even improved vascular health, an important bonus, since people with kidney disease often face a higher risk of heart problems too. If you are managing kidney disease, it is absolutely essential to consult your doctor before adding baking soda water to your routine. Because baking soda contains sodium, overuse can lead to high blood pressure or fluid retention, which can be dangerous for kidneys that are already working overtime. When used carefully under medical guidance, baking soda water may become a valuable part of your kidney support plan. It's not a replacement for prescribed treatments, but it may be a gentle ally in keeping your internal environment balanced and supporting your overall wellness journey. Think of it like giving your kidneys a little helping hand. A small, thoughtful act that supports your body's natural rhythms, helps prevent urinary tract infections, UTIs. If you've ever experienced a urinary tract infection, you know how uncomfortable, frustrating, and even painful it can be. That constant urge to go, the burning sensation, the discomfort that lingers even after using the restroom. UTIs are not just inconvenient, they can significantly affect your quality of life, especially for seniors. Older adults are more vulnerable to UTIs for several reasons. Bladder function changes with age, immune responses can weaken, and certain medications or health conditions may increase susceptibility. Women, in particular, may notice a rise in UTIs after menopause due to changes in urinary tract pH and reduced protective flora. Here's where baking soda water steps in as a gentle ally. Baking soda, being alkaline, can help raise the pH of your urine. Most infection-causing bacteria, like E. coli, prefer an acidic environment to grow and multiply. By making the urine less acidic, baking soda creates a less hospitable place for these bacteria, potentially slowing their growth and easing irritation. 2017 study published in the International Urogynecology Journal found that women who consumed baking soda supplements daily over 4 weeks experienced significant improvements in urinary symptoms. Their urine pH increased from an average of 5.3, acidic, to about 7.2, neutral to slightly alkaline, and many reported fewer feelings of urgency, burning, and nighttime bathroom trips. Baking soda water is not a cure for an active UTI. If you suspect a urinary tract infection, especially if you experience fever, chills, or back pain, it's crucial to see your doctor immediately. Infections can travel to the kidneys and become serious if untreated. As a supportive strategy, especially for those prone to recurring UTIs, occasionally drinking a small glass of baking soda water might help maintain a healthier urinary environment. It's a simple, natural way to assist your body, alongside good hydration, proper hygiene, and regular checkups. Think of baking soda water not as a replacement for care, but as an extra layer of protection, like carrying an umbrella on a cloudy day. Staying active is one of the most powerful gifts you can give your body as you age. Regular movement, whether it's walking, stretching, gardening, or dancing, supports heart health, keeps muscles strong, improves balance, and lifts the spirit. But let's be honest, exercise doesn't always feel easy, especially when fatigue and soreness set in faster than they used to. This is where baking soda water may quietly lend a helping hand. When you engage in physical activity, especially anything moderately intense like brisk walking, swimming, or light resistance training, your muscles produce lactic acid. This acid builds up when oxygen levels in muscles drop during exertion, causing that familiar burning sensation and leading to muscle fatigue. As lactic acid accumulates, the pH in your muscles drops, making them more acidic and causing tiredness and soreness more quickly. Baking soda, because it is alkaline, can act as a buffer. Drinking baking soda water before or after exercise may help neutralize some of that excess acid, raising the pH in your blood and muscles. This buffering effect can allow you to keep going a little longer, push a little further, and recover more comfortably afterward. A 2019 study published in the Journal of the International Society of Sports Nutrition investigated the use of sodium bicarbonate by athletes. The results were encouraging. Those who consumed baking soda before high-intensity workouts were able to perform longer and experienced less muscle fatigue compared to those who did not. While most studies focus on younger athletes, the biological principles apply across ages. Careful supplementation may also support seniors in staying active and feeling stronger. Too much baking soda before exercise can cause digestive upset, including bloating or cramping. It's important to start with a small amount, no more than 1–2 teaspoons dissolved in water, and see how your body responds. Also, drinking it about an hour before activity, not immediately before, gives your body time to adjust. If you're planning a brisk walk with friends, a gentle yoga class, or even working in the garden, a small glass of baking soda water beforehand, once or twice a week, might help you feel less sore after. It's not about pushing harder, but about moving with greater ease and recovering with more comfort. Think of it as adding a little extra kindness to your body's efforts, helping you enjoy the activities you love for years to come. Or halitosis is a common concern that can affect confidence and comfort at any age, but it often becomes more noticeable as we get older. Changes in saliva production, diet, medication side effects, and dental issues can all contribute to an environment in the mouth where odor-causing bacteria thrive. Sometimes, even with regular brushing and flossing, it feels like nothing completely gets rid of that stale or sour taste. Baking soda water may offer a gentle, natural solution to this everyday frustration. Because baking soda is alkaline, it can help neutralize acids in the mouth that encourage bacterial growth. When you drink or rinse with baking soda water, it raises the pH level inside your mouth, making it less hospitable for the types of bacteria that produce unpleasant odors. This simple adjustment can leave your mouth feeling fresher and more balanced throughout the day. A study published in the Journal of Clinical Dentistry found that participants who used a baking soda mouth rinse experienced significant improvements in oral pH and a noticeable reduction in bad breath compared to those who used plain water. Researchers concluded that baking soda's natural ability to neutralize acids makes it a useful addition to regular oral hygiene routines. While baking, soda water can support a fresher mouth. It's important to remember that it doesn't replace good dental care. Regular brushing, flossing, and dental checkups are still essential, but adding a gentle rinse or occasional sip of baking soda water could provide an easy, affordable way to maintain better oral freshness and feel more confident in everyday interactions. Drinking baking soda water in the morning or after meals may offer the best results, helping to reset the mouth's environment after sleep or eating. As always, moderation is key. Using too much or too often could upset the natural balance, so a light touch works. Symptoms gout is a painful and sometimes debilitating form of arthritis that tends to strike unexpectedly, often affecting the big toe, but also ankles, knees, and other joints. It's caused by a buildup of uric acid in the blood, which then forms sharp, needle-like crystals in the joints. The result is sudden, intense pain, swelling, and tenderness that can make even the lightest touch feel unbearable. As we get older, the body's ability to manage uric acid can weaken, making seniors more susceptible to frequent gout attacks. Diet, kidney function, medications, and general metabolic changes all play a role. This is where baking soda water may offer a small but meaningful source of support. Baking soda, being alkaline, can help raise the pH level in the blood and urine. In more alkaline environments, uric acid is more soluble, meaning it can dissolve more easily and be eliminated from the body through urine. This reduces the likelihood of crystal formation and may help lower the intensity or frequency of gout flare-ups. A 2024 study published in the British Journal of Hospital Medicine examined the effects of sodium bicarbonate supplementation in individuals with chronic gout. The study found that participants who took baking soda alongside their prescribed treatments experienced significant reductions in serum uric acid levels and showed fewer uric acid crystal deposits in their joints compared to those who did not. While baking soda is not a replacement for proper gout medications, it may offer a supportive benefit when used thoughtfully and carefully. It's important to approach this remedy with care, particularly because baking soda contains sodium, which can affect blood pressure. Seniors who are prone to hypertension or are on sodium-restricted diets should always consult a healthcare provider before trying baking soda as part of their gout management. When used correctly, baking soda water could be a simple way to help the body handle uric acid more efficiently, offering the possibility of fewer painful flare-ups and greater day-to-day comfort. Maintaining the right pH balance inside the body is more important than many people realize. Every system, from digestion to circulation to brain function, depends on a delicate balance between acidity and alkalinity. The blood, for example, must stay slightly alkaline, between 7.35 and 7.45, for the body to operate at its best. Even slight shifts outside this range can lead to fatigue, muscle weakness, impaired immune function, and other health issues. As we age, it's common for our internal environment to become slightly more acidic. This can happen due to changes in diet, reduced kidney efficiency, medications, or simply the natural aging process. When the body struggles to buffer this acid load, it can take a toll on overall wellness. Baking soda water offers a gentle way to support the body's natural buffering system. Because baking soda is alkaline, it can help neutralize excess acids and assist the body in maintaining its preferred internal balance. A 2024 study published in the Journal of Nutritional Biochemistry found that participants who drank bicarbonate-rich mineral water daily showed a significant increase in urinary pH, reflecting a healthier acid-base status and a reduction in net acid excretion. Supporting a slightly more alkaline environment doesn't mean chasing extreme diets or drastic measures. It can be as simple as incorporating a small occasional glass of baking soda water into a broader lifestyle of balanced eating, hydration, and gentle movement. It's a reminder that sometimes small, thoughtful choices can quietly support the body's resilience and energy. Reduces muscle soreness. After activity, even with regular exercise, muscle soreness can creep in, especially after activities that are a little more strenuous or new to the body. For seniors, that post-activity stiffness can last longer and feel more intense than it did years ago, sometimes discouraging future movement. This soreness, often called delayed onset muscle soreness, or DOMS, results from microscopic tears in the muscle fibers and a buildup of metabolic byproducts like lactic acid. Baking soda water may offer a simple, natural way to ease this discomfort. By helping neutralize excess acids that accumulate in the muscles during exercise, baking soda can reduce the intensity and duration of muscle soreness. A study published in Frontiers in Nutrition found that individuals who supplemented with sodium bicarbonate after strenuous exercise recovered faster, experienced less pain, and were better prepared for subsequent workouts compared to those who did not. For seniors who want to stay active without being sidelined by soreness, a small glass of baking soda water taken after particularly vigorous activities could make a meaningful difference. It supports the body's natural recovery process, helping muscles return to balance more quickly and reducing the temptation to skip the next walk, swim, or gardening session. Staying consistent with movement is one of the best ways to preserve vitality in the later years, and having a simple tool like baking soda water can make it easier to keep going. 9. Acts as a natural antacid. Occasional indigestion, bloating, and an upset stomach are familiar issues for many seniors. The digestive system, like every part of the body, changes with time. Stomach acid production can become irregular, sometimes too much, sometimes too little, leading to uncomfortable symptoms after eating. Common culprits include large meals, rich foods, stress, and even the natural slowing of digestion that comes with age. Baking soda water has long been used as a home remedy for occasional digestive discomfort, and there's good reason for its enduring popularity. Because baking soda is alkaline, it can neutralize excess stomach acid quickly, bringing relief from feelings of bloating, nausea, pressure, and that all too familiar burning sensation after meals. A study published in the American Journal of Gastroenterology highlighted the effectiveness of sodium bicarbonate in rapidly increasing gastric pH and reducing symptoms of acid-related discomfort. Unlike many commercial antacids that contain artificial additives, baking soda is a simple, natural option when used thoughtfully. For seniors who experience occasional upset stomachs, a small glass of baking soda water after a heavy meal can offer gentle, fast relief. It's an easy, affordable solution that can help bring more comfort to daily life without adding another pill to the routine. As always, it's important to use it occasionally and not as a regular crutch, especially if digestive issues become persistent, as that could signal a deeper health concern requiring medical attention. Potential support in cancer care. The idea that baking soda could play a role in cancer care might sound surprising, but it is an area of growing scientific exploration. Cancer cells tend to create an acidic environment around themselves, which not only supports their growth, but can also make certain treatments like chemotherapy less effective. Cancer cells tend to create an acidic environment around themselves. Scientists have been investigating whether altering the pH around tumors, making it less acidic, might slow cancer progression or enhance the impact of therapies. Baking soda, being a natural alkaline substance, has attracted attention for its potential ability to raise the pH around tumors. A landmark 2009 study published in Cancer Research found that in mice with breast cancer, injecting sodium bicarbonate directly lowered the acidity around the tumors. This shift was associated with a slower spread of cancer cells and improved outcomes. Although these results are promising, it's crucial to recognize that most of the research so far has been in animals, not humans. Currently, baking soda is not considered a proven or recommended cancer treatment for people. Its potential benefits are still being studied, and it should never replace traditional cancer therapies prescribed by oncologists. However, it does offer an interesting glimpse into how something as simple as pH balance can play a role in complex health challenges. For those undergoing cancer treatment, any interesting complementary approaches like baking soda should always be discussed with a medical team to ensure safety and avoid interference with essential care. Soothes minor mouth and throat irritation. Minor mouth and throat irritations are common, especially among seniors. Dry mouth, canker sores, and scratchy throats can arise from medications, dehydration, breathing through the mouth at night, or exposure to allergens. While these issues are often not serious, they can cause significant discomfort, making eating, drinking, and speaking less enjoyable. Baking soda water offers a simple, soothing option for these everyday problems. Thanks to its mild alkalinity and gentle antiseptic properties, a baking soda rinse can help neutralize acids in the mouth, calm inflammation, and reduce bacterial growth. When used as a mouthwash or gargle, it can ease the sting of canker sores, soothe dry, irritated tissues, and create a fresher, more comfortable environment in the mouth and throat. A study published in the Journal of the American Dental Association highlighted the effectiveness of baking soda rinses in reducing oral irritation and promoting healing. Participants who used a simple baking soda mouthwash reported less pain and faster improvement compared to those who used plain water. For seniors dealing with frequent mouth discomfort, incorporating a light baking soda rinse into the daily routine can be an easy, natural way to promote oral comfort and health without relying on harsh chemical products. It's another example of how small, consistent acts of self-care can make a big difference in daily well-being. Supports skin comfort and soothes irritations. The skin is the body's largest organ, and it changes significantly with age. It can become thinner, drier, and more sensitive to irritants. Conditions like eczema, psoriasis, insect bites, sunburn, and simple dry patches can all cause itching, redness, and discomfort, sometimes making daily life more challenging. Baking soda water, used externally as a soak or rinse, can offer gentle relief for irritated or itchy skin. Its natural alkalinity helps neutralize acids on the skin's surface, while its mild anti-inflammatory properties can calm inflammation and promote healing. Adding 1 to 2 cups of baking soda to a lukewarm bath and soaking for 15 to 20 minutes can provide soothing relief, helping to reduce itchiness and soften rough, irritated areas. A review published in the Journal of Dermatological Treatment found that baking soda soaks can be effective in managing symptoms of chronic skin conditions. Participants reported less itchiness, improved skin texture, and better comfort overall after using baking soda in their self-care routines. While baking soda is not a cure for serious skin diseases, it can be a valuable, affordable addition to home care practices for seniors seeking relief from everyday irritations. Always be sure to moisturize the skin afterward, and for persistent issues, consult a dermatologist to ensure the best possible care.